Hello, I'm Winnie Fritz. I'm a nurse and a healthcare executive. I'm a member of Shepherd of the Hills United Methodist Church in the Phoenix metro area and serve on the Desert Southwest Conference Health and Caring Ministries team. Today we're going to talk about parish nursing, sometimes called faith community nursing. Parish nursing is oftentimes referred to as faith community nursing. As a general theme, we would describe it as a health ministry meeting the needs of congregations and communities. Let's learn together. How are we going to spend the next few minutes together? What objectives would we like to meet? First, we'll explore why are we even talking about this role of parish nursing? Second, what is a parish nurse? What is a faith community nurse? 3, what is the history behind this role? 4, what does this nurse do and not do? What model works for having a parish nurse or a faith community nurse in your congregation? And how can you learn more about this role? Let's explore these questions together. Why are we even talking about this role of parish nurse or faith community nurse? Those expressions are oftentimes used interchangeably, so throughout the presentation I may choose one or both of those names to refer to the role. First of all, we're talking about this role because we as Methodists believe in health of body, mind, and spirit. It's a part of who we are. Also, we know the U.S. spends almost 3 times what other nations spend on health care. And yet, for all of that investment, we rank 17th among our peer nations in healthcare scores, such as life expectancy, mortality rates, and such things as immunization rates. Why are we talking about this role? Well, in the U.S. healthcare system, we are very focused on the radical changes that are occurring. We know of this as the Affordable Care Act, and healthcare systems, hospitals all over this nation are working to achieve the triple aims. They are, we all together want to achieve better care and care experiences. We also want to have better health for the population as a whole. That is, at the end of it all, we want healthier people. And, as important, we want lower cost. Why are we talking about this role? Well, the American Hospital Association is interested in this role and the many other roles in the healthcare system, as they have created in this current year principles for a new healthcare system. If we talk about providers in our new healthcare system, we certainly want to put the whole person at the center. That is, the patient, the mind, body, and spirit of the patient at the center of the healthcare experience. We want to engage and empower patients. In the past, our healthcare system has been a patronizing system in which we tend to say to patients, "Don't worry, I'll take care of it." We are transitioning to engage the patient and to be quite transparent with medical records and with information about disease. Third, we really work to coordinate care among the providers. Not just the hospital, but if the patient is now going home, going to a skilled facility, going to a rehab center, there is an urgency in better coordination of care. 4, we recognize that it's not just the physical. We must integrate social and behavioral and spiritual issues of our patients into the plan of care. 5th, we need to be collaborative. This is physicians, nurses, physical therapists, home health aides. All of us need to collaborate together with the patient and family if we are going to come up with a plan of care and successful healthcare outcomes. Next, we want to integrate the care into the community. You may have heard this expression, but healthcare is no longer hospital-centric. We think of many more experiences in healthcare as occurring outside the hospital than in the hospital. Hospitals are transitioning to be settings for intensive care, trauma care, and acute diagnosis and treatment with short length of stay. And finally, we want all parts of the healthcare system to be safe and reliable. Finally, We all know the healthcare system in the United States is very complex. Every one of us, whether we're a healthcare provider or in the patient role, we all need navigators and advocates to help us get through the system. Our parish nurses, our faith community nurses help us to fill this critical role. Now, let's define this role a little bit. What is a parish nurse, a faith community nurse? You'll see some of these acronyms, the PN or the FCN, sometimes in literature or in presentations. I just want to introduce you to those expressions. This nurse is a specialized professional nurse who focuses on promotion of health in the context of a faith community. Let me reinforce that this is an active duty nurse. This is not a retired nurse or a nurse with an inactive license. This is an active nurse with an active license in a specialized role. The nurse is working to improve the health of a faith community's members, a particular congregation, as well as those in the broader community of that faith community. If we were to see an ad for a nurse position in this role, we might see requirements for a minimum of 2 years of experience as a nurse and wanting someone who has completed a parish nurse course recognized by the American Nurses Association. Most positions today require a minimum of a bachelor's in nursing degree with 5 years of experience caring for med-surg patients. Community health nursing or care of chronic disease patients is a real plus for those who serve in this role. What is the history of this role? Well, early roots are in the work of deaconesses and religious communities, sisters and clergy. We also find writings back to our own Wesleyan beginnings of his work and concern for faith community nursing. Now, our contemporary roots are in the 70s and 80s when Reverend Granger Westberg initiated holistic health centers in the Midwest. Today, the role is governed by the scope and standards of parish nursing within the American Nurses Association. Around our nation, we'll find 15,000 parish nurses or faith community nurses in the United States, in every state, and we find them around the world. There are Christian parish nurses. In Jewish communities, we often hear the expression of congregational nurses, and in our Muslim communities, we hear of crescent nurses. Well, what does this nurse actually do? You see on the left-hand side, we can actually use the word health to guide us in what this nurse does. H, this nurse is a health counselor, helping people in the congregation and the related community to understand disease conditions, to understand more about their medications or what therapies might be recommended for them. E, they're very busy as educators on health issues, on understanding the healthcare system, and also on how to stay healthy. A, an important role is being an advocate or a resource person on using the system, resources in the community where they might get assistance in getting healthy or staying healthy. L, this nurse is an important liaison, a referral agent to get people to the right sources. We have an expression in healthcare, we're always trying to get the right patient to the right place at the right time for the right care at the right cost. And this nurse plays a critical role in that activity. T, oh, they are teachers, busy developing volunteers and support groups in our churches and in the neighborhoods. H, they're focused on healing of body, mind, spirit, and the community in which we live. What might we see this nurse doing day in and day out? Well, we might see him or her visiting members of the church at home, in the hospital, in hospice, or in rehab centers. They might be providing health screenings, leading a support group, organizing and teaching a class, serving on the pastoral care team, counseling a family regarding a loss, learning about a new healthcare resource in the community, meeting with the hospital care team to improve care coordination following a patient's discharge, attending local parish nurse organization meetings, or writing an article in the congregation's newsletter. Now, what does this nurse not do? Well, by definition, we will typically not see this nurse providing direct clinical care. One would not typically call this nurse to the home or arrange a visit to change a dressing, to give immunization, to irrigate a catheter. There are other roles in the community that serve this function. So if your congregation would like to have a parish nurse, what are some models that work on having a parish nurse in a congregation? I'll highlight just 4 possibilities. There are employed models and there are volunteer models. Again, I want to emphasize this is a nurse with an active license, but in some cases they are employed and in other cases they volunteer their time. One example could be that one church supports a full-time or a part-time nurse. Sometimes several churches support one full-time or a part-time nurse. We will find examples of a group of volunteer nurses supporting one or more churches or faith communities. A nurse on staff at a hospital or a clinic is supporting a church or a faith community as a part of his or her job. And finally, how could I learn more about a faith community nurse or parish nurse role? I have listed here some resources that you can have access to, certainly contacting the International Parish Nurse Resource Center, contacting Sharon Hinton, who is a parish nurse consultant for the United Methodist Church. There are resources from the American Nurses Association, and finally, the Health Ministries Association provides additional publications and resources. We've spent a few minutes talking about the parish nurse or faith community nursing role. We've gone over why in the world we're even talking about this role, the critical role they play in our changing healthcare system. What is a parish nurse or faith community health nurse? We've defined the role. We've explored the history of this critical role. We've talked about what this nurse does and doesn't do. We've talked about models that work in our congregations and identified some additional resources. Most of all, we are grateful for these nurses who work so faithfully to improve the health and healing in our faith communities.